Doctor, we have so many great representatives, and we welcome them all and thank them all. Dr. Clayton Young, obstetrician, gynecologist from Montgomery County, where he lives with his wife and 4 children. He's been working in the area for 24 years, and he's going to give some input on his experiences with the vaccine.
Thank you for inviting me to speak. I can't really add to legislative stuff, and we've been up several sessions and testified Senator Hall's original bill for prohibiting vaccine mandates, but I just wanted to just briefly speak to a couple of real-world situations, if you will. A couple of years ago, and stop me if I start running too long, a couple of years ago, I was recruited by a local facility. I live in the South Montgomery County and work in the North Houston area, and they it's a surgery center that had obtained a robot, and they were looking for additional physicians to staff that. They had a need, and they sought me out, and we went through the process, and we filled that need. Same hospital system, almost simultaneously had a need in Humble. I also do some OB hospitalist work where you go in and you're basically the emergency OB on call in-house. They had an actually a fairly urgent need. We went through the credentialing process and we solved that need. So fast forward 18 months, well, part of the credentialing process you have to go through is they require certain vaccines to be on medical staff. And being that I'm 57 years old, I don't have really my vaccine records. I wasn't a good record keeper. So instead of going through a whole series of vaccines to get caught up, I was allowed, which is in their policy, to have vaccine titers drawn. Oddly enough, I haven't had hepatitis B shots since I really did medical school, DPT, the whole thing. I was immune across the board. Those were accepted without question, not once but twice, because it's 2 separate credentialing procedures. So now, as of tomorrow, I'm not going to have clinical privileges at this particular 2 institutions because I'm not taking the vaccine. One question is, well, why do you do that? Well, I wasn't going to take it in the first place. But second, I also had COVID, and I have antibody tests to prove it. And in discussing the situation with the regional chief medical officer of this particular institution, that's not acceptable, even though their previous policy said it was okay for all other vaccine-preventable diseases. He said it would be logistically too hard to keep testing people for antibody tests. The thing about that is, if you get an exemption, you have to test twice a week. And so that didn't really make any sense to me. So that's the first part. I have another colleague who actually was fired or let go from Methodist. He's a physician. He has the same situation. He's currently in legal discussions about getting back on staff there. Same situation. He has antibodies. It's really not safe, as Steve alluded to earlier, to take the vaccine when you have antibodies. It increases your risk of adverse reaction, some of which can be serious. I also have another, how am I doing? Okay? I just don't want to take all y'all's time. Another colleague who just came up yesterday. He's an anesthesiologist. They're in the face all the time, high risk for exposure. He had both his vaccines, and he's going through some medical procedures, has elderly parents, so he was curious if he had antibodies and if he needed a booster. I'm not sure exactly when he got his vaccine or his series, but long story short, he got tested and his antibody titer was 0. That's an important point to make because if you're not testing these people and they're out there, they're offering no protection to themselves or their patients. But people that have antibodies, if they don't have the vaccine, they're not allowed to practice. So that's also a very hard thing to follow. The CDC is no longer following what they call breakthrough infections, so we have no idea what those numbers are. That's because they don't want you to know. I gave you a situation, and it kind of ties 2 things together. one of the problems that we're having in healthcare right now is both nursing and physician shortages. That's for several reasons. Most people are burnt out. The state had created this nursing, I don't remember what it's called, it was a nursing surplus where if a community had a certain need, they could go in and hire from a pool of nurses that were getting paid exorbitant fees to go and fill a need. And they would lose the local community hospitals and they would just never come back. And there's a bidding war for nurses and doctors right now, and the high price wins. So I gave you an example of how this is affecting care, and I'll stop at that. I had a lady, who's actually not my patient, but I'm in a position to help with regional health care. I was in a hospital north of us, a rural hospital north of us. I was 24 weeks pregnant and actually getting pretty sick and needed to be transferred to a high level of care. With the assistance of our director, we called pretty much everybody in the state. It took us 4 days to get her a bed out of there, and by the time we got her transferred, she transferred down to Clear Lake. She was intubated, the baby decompensated. They delivered the baby, and then she decompensated, and they had to transfer her to another facility that had ECMO, which she needed at the time, all because not necessarily of hospital room shortages, but staff. All the numbers that you're seeing that they're saying they're only 1% of their working staff that are being dismissed, that's going to add up in a hurry. And if you think we have a healthcare provider shortage now, I think it's going to get worse. That's it. Thank you for your time.
Thank you. Thank you. Thank you.